I think, yes, huh? It's better.
Can you all hear us online?
Yes, we can.
Okay, thank you, Dr. Manuel. Okay, we're gonna just give it maybe one more minute so that those in the room can get settled in, and then we'll go ahead and get started. And Dr. Maniwala, I think we're ready to get started, but if you don't mind, we're gonna just do a few little housekeeping things for those in the room. So if I could pass it to Anne really quick before I get started. Okay.
Wonderful. Well, good afternoon, everyone. It's great to see many folks in person here. And for those that are joining us from this morning's back meeting, thank you for hanging with us for a full day. I'm really grateful that you all have taken the time to be here, joining us by car and train and plane, I believe all of the above. So I'm really grateful for your time. I know Monday and a holiday week, no less. It's a big sacrifice, and we really do appreciate your commitment to this work and your feedback on the program. So for folks that are here in person, I'm super thrilled that we're at the Historic Westside School today. It's a lovely space, so I recommend folks walk around and take a chance to see the facility as you have time. If you need to use the restroom at any point, feel free to step out. The code up here is top right corner, and there are exit doors on both ends of the hallway as well in event of emergency. I also want to thank our colleagues at Health Plan of Nevada who are here and provided refreshments for this afternoon. So please feel free to, as always, to hop up and grab snacks or more caffeine as you need throughout the afternoon. But really thrilled, again, for the chance to be here in person and to be with you all. So with that, I'll turn it to Dr. Manuela. Turn it to you.
Perfect. Thank you all. And I echo the thank yous with all the travel disruptions. Thank you for being there. I apologize I could not be there in person, but I'd like to go ahead and call the meeting to order. On the behalf of the Nevada Health Authority, Division of Nevada Medicaid, we'd like to officially call this meeting to order and verify that the meeting is being recorded. Is the meeting being recorded?
Yes.
Okay, perfect. Today's meeting agenda for the Medicaid Advisory Committee was posted on October 8th, 2025 on dhcfp.nv.gov and at notice.nv.gov. Just a quick reminder that the agenda items may be adjusted as needed. For today's meeting, we'll be switching items 10 and 11 to review the administrator's report before moving on to the presentation portion of the agenda. And with that, I'm going to go on to agenda item number 2, which is the disclosure of conflicts of interest. Please disclose any conflicts of interest that you have at this point in time. Are there any conflicts of interest? I'll give it another 15 to 20 seconds here.
Seeing none here in the room, Dr. Manuel.
Okay, hearing none and seeing no hands raised, I'm going to go ahead and go on to item number 3. If there are any conflicts of interest, please send them our way. So agenda item number 3 is the roll call. And with that, I'm going to start with Administrator Ann Jensen.
That's it.
John Phoenix.
Present.
Dawn Lyons.
Present.
Dr. Todd Gray. Sharon Austin Moffett. Desiree Gomez. Casey Melvin,
Present.
David Escamay,
Present.
excellent. Kim Gagan,
Here.
Nicole King, Bill Sims,
Present.
Azarella Gravel,
Azraella, present.
sorry, Azarella. Kaylani Queen,
Present.
Sarah Dearborn,
Present.
Robert Thompson,
Present.
Rick Robb,
This is Cheyenne Pasquale attending on behalf of Ricky Robb.
okay, got it. Kimberly Abbott,
Present.
excellent. Jonathan, have we met the quorum requirements?
Yes, definitely. Well, we met the quorum requirements.
All right, excellent. And with that, we're going to move on to item number 4, which is the public comment. If you would like to make a public comment, please raise your hand or type public comment in the chat and the last 4 digits of your phone number and or your name, and you'll be called on once that starts. Please state your first and last name at the beginning of any comment for recording purposes, and you will have 3 minutes to speak. Jonathan, please let me know if there are any comments in the chat.
Seeing nothing as of right now.
We have a public comment in the room. Dr. Mayhall.
Okay,
Hello, this is Grace. Can y'all hear me? This is Grace Larkins, Chair of the Beneficiary Advisory Council. And I was speaking with some of the MAC members today that in lieu of having an agenda item for the back, for the back to give an overview of our meeting, somewhere near the beginning, that for today would just go ahead and have me give that during this public comment portion. So just a very quick overview of our back meeting today. We spoke about providers and on many levels, the in-network provider and the access and ease of understanding who is in network and the future of having a robust provider network. On the recipient level, we spoke about enrollment and some specific vulnerable populations as well for the homeless or substance use disorder populations. Related to that is the mechanisms for updating on policies, programs. So finding out about those state and federal data changes. Sorry,
The state should award extra points, if they should award extra points to a nonprofit. Really happy to see the RFP awards no extra points.
Just a reminder for those online to please mute themselves if they are not speaking. Thank you.
Great. So just updating on federal, state, cost sharing, et cetera, data in the future. And we talked about the outreach efforts, the best ways to keep the public updated on Medicaid as things are unrolling. So what are those outreach approaches, whether it be online, printed, et cetera, in all different areas of health, education, wellness, and even doula services was mentioned. This we'll speak to, I think, a little bit later, but we're working on a back work plan potentially, something to put on a future agenda. And lastly, just sort of the procedural and forms aspect of how that is for recipients and those trying to enroll, even providers, are those forms and pathways accessible? Is it plain enough language? And are they relevant and actually some doable for providers? And I think that about covers it.
Excellent, thank you. Are there any other comments?
No other comments.
All right. Well, hearing none, I suppose we will advance to agenda item 5. And I'd like to personally welcome back all of our members, those who are able to join in person despite all of the travel difficulties, and those that are able to join virtually. Are there any particular individuals that we would need to introduce at this point in time? Jonathan? Others?
Are there any new members on the call that would like to introduce themselves, or do we want to do just a very quick little introduction of who you are and why you're here for the members today? Dr. Medibala, are you okay?
Yeah, that sounds good.
Sorry, yeah, we can do a quick introduction. Do we want to start in the room? Or I can start myself really briefly, and then we can go through the room, and then we can go online. But just to introduce myself, Rahul Mediwala, I'm a nephrologist, been practicing for a long time, but practicing in Nevada since 2008. And I'm the chair practicing up here in Northern Nevada at Renown.
Thank you, Dr. Medibala.
My name is Casey Malvin. I'm an occupational therapist and CEO of Tilton's Therapy Tots. I'm delighted to be here and humbled to be the vice chair with efforts to really increase access to care for all of Nevada.
I'm Grace Larkins, the chair of the Beneficiary Advisory Council. I am the mother of an almost 11-year-old with complex medical needs and who uses the Katie Beckett eligibility option to receive Medicaid. And I also work for the Nevada Center for Excellence in Disabilities, helping to improve access and quality of life for other families who have children with special healthcare needs.
Hi all, I'm Jensen. I'm the administrator here at Nevada Medicaid. And I'm really thrilled to be here.
I'm Bill Sims. I'm a Beneficiary Advisory Council member, and I'm here just like with back as someone who receives Medicaid, just to see what I can do to help make Medicaid more accessible and easier to use for people wanting.
Good afternoon, I'm Kim Abbott. I serve as the deputy administrator at DCFS, for Children's Mental Health Services for the state of Nevada. Prior to taking on that role about 2.5 months ago, I was a children's attorney at the Legal Aid Center of Southern Nevada for 11+ years, representing some of the highest needs in our system, all of these persons.
I'm a Medicaid administrator and families for almost 2, and I've been in Las Vegas. So I was 3 years old, so it's a very long time, and I'm excited to continue to serve.
Do you have any members? Any other committee members?
Hi, my name's Nicole King. I'm the Vice President of Government and Community Relations for Silver Summit Health Plan. So happy to be here. Thank you.
Hi, everybody. My name is David Escami. I'm the Community Relations and Marketing Director for Anthem Blue Cross Blue Shield. And I've been with the company for almost 22 years and proud to be presenting to the formerly MCAC, now MAC, since 2018.
Good afternoon, Kim Gahagan. I am the Associate Vice President of Growth and Community Engagement for Molina Healthcare of Nevada.
Good afternoon. My name is Sarah Dearborn. I'm the chief over our medical, dental, and behavioral health benefits coverage teams for Nevada Medicaid. And I'm happy to be here. Thank you.
Good
Hi,
afternoon.
I'm
Good afternoon.
Gavel. Sorry,
Go ahead.
I'm Azraella Gavel. I am the vice chair for the beneficiary, the back committee. I am happy to be.
Good afternoon. I'm Robert Thompson. I'm the administrator for the Division of Social Services. Good
Hi,
afternoon.
everyone.
Go ahead.
This is Dawn Lyons. I'm the executive director for the Statewide Independent Living Council. We represent people with disabilities across the state.
Good afternoon. I'm John Phoenix. I'm a family nurse practitioner in Las Vegas.
I'm Cheyenne Pasquale. I'm the agency manager with the Nevada Aging and Disability Services Division over the Office of Community Living, sitting in with for Ricky Robb, who is our administrator.
I think that might have been everyone. Yeah, I think that's everyone. Dr. Manuel, unless.
Excellent. Thank you for your introductions. And with that, I'm going to turn over agenda items 6 and 7 to Vice Chair Melvin.
Thank you so much. The meeting minutes were sent to council members on September 11th, 2025 via email for review. Is there any discussion on the minutes at this time? Any of them? Yeah, just quickly scroll through. Okay. The meeting minutes were posted. We had agenda items including a call to order, roll call, public comment, committee member introduction, overview of the Medicaid Advisory Committee, discussion of the need for chair and vice chair positions, an administrative report by Ann Jensen, as well as discussion of MAC bylaws, voting on MAC bylaws, and establishment of the next meeting, which is today, and public comment. Any questions or comments? Seeing none online, I motion to approve the minutes.
This is John Phoenix. I'll second.
Okay, so all committee members in favor of passing the minutes, say yay. Yay.
Yay.
Yay.
Yay.
Yay.
All committee members in opposed, please say nay. The motion passes and the minutes are approved.
Just for the record, can have it, I'm abstaining because I was on here.
Thank you.
Then for agenda item number 8, I will pass it back to Chair Madam Sullivan.
Thank you. Thank you. So in our discussions, our purview in terms of this committee is relatively broad. And so in discussions with Vice Chair Melvin and others, we have thought that creating a work plan that structures the discussion across the year and having specific points for different areas of discussion would be important. This would not only cover the expected and required discussion points that this committee holds to, but also allow input from the members of this committee into what is important and the right time to discuss it. With that, there is a skeleton or a beginning, but this is by no means the final item. This is just there to provide some degree of structure for your input. Vice Chair Melvin, any thoughts on or any additions that you would have with regards to our discussions?
So I think those in the room got a copy of the work plan. Like Dr. Mediwala stated, some of the items that were placed on here are kind of around the requirements of the committee, as well as some of the items that were mentioned in the last meeting. But by no means is this final, and so we're really looking to grab some input here and just bring this to this discussion. So feel free to jump in and add any input here.
So my thoughts are there's going to be several stages of this, and what I would ideally like is some degree of input into important points that we want to include in terms of the discussion. That discussion will be had here, but we will also very clearly give everyone adequate time to completely and thoroughly review the document. And the expectation is to have a two-week period for comments and discussion at a more in-depth level. But I'd like to take a few minutes at this meeting and at this juncture to actually just review this and give whatever thoughts you have and put them all on the table.
So sections included in this work plan, if you don't mind me jumping in, Dr. Mediwala, include just an overview of the committee, some goals and objectives, and like I said, these are just some examples. By no means are they final, and how they align with Nevada Medicaid priorities. We've also included in a section that includes key activities and deliverables. So for example, one piece of this committee is, or one of the responsibilities is to review marketing materials for the managed care plans for the next year. And so that is something that we've placed in there, as well as developing the annual report, which will be due on July 1st of next year. Something that was brought up at the previous meeting and what we'll be having some presentations on today in this meeting is reviewing legislative implementation and providing some feedback on that. And then we included a section of our meeting schedule. And so this is just kind of a, like I said, a draft. By no means is it final, but we thought we could kind of lay out where we want to discuss specific goals or deliverables or topics at future meetings to kind of shape the meetings over the next year. And then just a section on evaluation and reporting. We, as the VAC support team, can bring back to this committee a percentage of the recommendations that were adopted by the state Medicaid agency. So you guys can see, you know, how are the recommendations being implemented, and is it working? So that's something that we've included in there, and then just in an appendix of resources and support. And so if you're looking for specific presentations on any of these topics to get some more background, that you could come to us, the MAC support staff, for data reports. I believe that was something that was mentioned in the Beneficiary Advisory Council meeting, is if there are any data points that the committee would like to look at, we can go and start requesting specific data for you all, and include that in one of our next meetings, as well as just a couple of other things. And so, like Dr. Mediwala said, this is definitely a working draft and something we'd like to get feedback on from all members, but wanted to bring it to this as a discussion item and see if there's anything off the bat that anybody would like to add on here.
One thing I think was really helpful from our back meeting this morning, and I'd welcome our back members to keep me honest on how I'm doing this, but I think there's a lot of value in thinking about how we talk about health and wellness materials for beneficiaries once they're enrolled in the Medicaid program. So I know we already have the marketing materials listed here, but I wonder if it'd be helpful to also add those as well, both from our fee-for-service program and from our managed care partners, to come talk about how do we make sure people know what benefits they have access to once they're enrolled in the program, and communicate that in a way that's really effective and also really meet people where they are to really access and be aware that they have those benefits available. So that's one recommendation I would have to add, in addition to reviewing marketing materials, reviewing those health literacy and wellness awareness materials for both the managed care plans and our members. Grace, Bill, Kalani, any thoughts there? Good.
I like it.
Okay, sounds good.
So once more, there's a lot to discuss here.
Sorry, Dr. Medical, we have someone in the room here. Sorry to interrupt.
Sorry.
Oh, sorry.
I did have a quick question, Bill, since for the record. So would that be something that like you would be able to cover both for like what we were talking about, both for people like on like Medicare, our Medicaid plan, and people on fees for service Medicaid?
Yes.
Okay.
To do both the state materials for fee-for-service and the managed care materials.
Yeah. Okay.
I would like to see access to care in terms of network adequacy, reducing transportation barriers, providing in-home care, and essentially making sure that we have enough providers. So some of this is broken out with expanded healthcare workforce, but I would like to see another one really just breaking down barriers to care.
Grace Larkins for the record. I absolutely support that, and I had a similar, I was going to give a similar comment. I also wanted to just put out there that within the Beneficiary Advisory Council, we ourselves, as I mentioned earlier, are talking about putting together our own work plan, and we're wanting to make sure that ours really complements the back work plan really complements and kind of flows into to help feed the MAC work plan. So, you know, we just received this on Thursday afternoon, I think. So we were hoping for potentially a little bit more time to review it, to look at some options for our work plan, and put it on the agenda for the next meeting as far as any actual voting goes. But that is just a recommendation. Sorry, I should also say that I was very impressed with this, and I really appreciate the effort that went into it, and I think it's very, very helpful.
I second Chair Grace's recommendation that this is an excellent work plan, and mitigating a work plan that complements the back work plan is also advisable.
I think I saw David's hand up as well.
Hi, everybody. David Ascami with Anthem. I do see there's a lot of, and I don't know if it falls under the first category, but with changes that are coming, workforce requirements or work requirements, and also having to renew on a twice annually instead of once annually. So there's, I think those are very specific, but on a larger category, I don't know if improved beneficiary engagement, if those fall under there, but there's probably some room to talk about members who are at risk of losing coverage.
Yeah, thanks, David. I'm happy to respond there briefly. I'll touch on the federal legislative changes in my administrator's report, but I do, and I'll note this there as well, we're really eager for impact on how best to communicate some of these changes to our members, and I would love for that to be an explicit part of this work. Perhaps just eligibility process more generally would be really helpful to give feedback. This is a theme from the back as well, but feedback how that really, that kind of journey to get access to care looks like for folks, and how can we make that as clear and straightforward as possible, both now and when there are changes to that process as well. That's a good flag.
This is Kim Abbott for the record. And again, I'm new and this is my first meeting, so apologies if maybe others have a better grasp on this, but from just looking at the goals, they're big goals. They're lofty goals without a lot of specificity. And if this is a work plan, the key activities and deliverables don't necessarily line up exactly with the goals and objectives. And if we're meeting 4 times a year, like, that's a lot, not a lot of work time to work towards some very, very big goals. And I'm just wondering, they need to be more specific, more measurable, more sort of bite size, especially if you're going to be tracking compliance and implementation and things like that. To just say we've expanded workforce, that's enormous, right?
We can definitely, I think that, so the work plan kind of came about after discussion with the chairs and vice chairs from both committees and kind of forming, shaping the meetings over the next year and the specific topics each committee would like to discuss. And so we actually put this together just kind of broadly and as an example. And yeah, I think that we can grab all of the things that are discussed here and kind of create more SMART goals, right? To implement in Severe and then bring it to the next meeting and kind of work through those more specifically and maybe get more into the nitty-gritty of each goal. If that works. Yeah, we're happy to kind of put all of it together, send it all out to everyone and get some feedback via email and then also still bring it back to the next meeting. I see Monica has a question.
Hi, Monica Schiffer with Nevada Health Authority, Nevada Medicaid. Nice to see everybody in the room. I think it could also, perhaps, depending on what your schedule looks like and the time, utilize some of this time to focus on what those more specific, I think I heard Dr. Mediwell saying, get more specific ideas for you folks to drill down to if your agenda and time allows. Now, I think that's what he's looking for is like what Kim said, okay, these are very lofty to do in 4 meetings in a year. So how would we as a committee look at what is more manageable, looking at what the ideas that the MAC support staff has helped compile based on suggestions and bringing it down to more manageable pieces.
I see John Phoenix as well has his hand raised.
Hi, John Phoenix for the record. Question about a number under 2 goals and objectives, expanding the healthcare workforce. So retain, oh, I see recruitment, but one of the things under recruitment that I think needs to be looked at specifically from the provider's perspective is the clawbacks from the MCOs. For example, I got a notice from my practice that was almost 12 months after the fact, asking for a significant amount of money back because they say they overpaid me, but yet my timeliness of claims has to be within, 60 to 90 days or 6 months. So I think there should be some limitations put in there because I personally find that as a big dissatisfier. Why the MCOs can come, 12 to 15 months after the fact and ask me for money back.
Thank you for sharing. John, thank you.
Grace Larkins, for the record. Is there interest or potential for subcommittees? Or is there the administrative support for something like that? Or on some of your bigger items that we might come up with?
I think, yes, we do. There is, yeah, we can definitely work on doing a subcommittee as well. Monica,
I'm sorry, and support, yes.
And support, yes, we could support that, yes.
Casey Melvin for the record. I think to extrapolate on what John Phoenix was also saying from a provider standpoint and looking at retaining providers on Medicaid would be looking at administrative burden. So I did listen into the fact meeting this morning. There is legislative efforts to shorten the prior authorization time. I think that goes hand in hand. But just as an overarching, and then I think we need to get more granular on what that can look like. But administrative burden on the provider side and streamlining processes to expedite care would be super helpful.
John, I see you have your hand raised.
Yes, hi, John Phoenix for the record again. Kind of tagging on to that prior authorization. That is an extremely intense, unreimbursed, uncompensated amount of financial burden on the provider's office. So we need to look at ways to minimize that because, for example, if I have to get a prior authorization for 10 patients in the given day on medications because they don't fit into the formulary needs, that's a huge chunk of my admin time from my staff as well as myself that we don't get reimbursed for. But we're doing the same with all these prior authorizations, and like, why are we, putting all this extra burden on the providers and not compensating them for that?
Comments or suggestions for the work plan? Your comments and suggestions will really help Jonathan.
Hi there, this is Azraella. Should I raise my hand? I'm sorry.
Azraella, go ahead.
Okay, I appreciate it. So what would the requirements for subcommittees for the work plans going forward look like? Given that we have quarterly reports of what Medicaid brings to the committee during each meeting. That's a lot of information. And if we can break that information up and designate roles in these subcommittees, whether it being evaluation or provider care, as well as patient care and access to care in general, that would be great. I would love to hear you guys' comments regarding this.
Yeah, I think that they can look like however you all want it to look like as far as the subcommittee goes.
I know there's like limitations that was in the legislation about forming a subcommittee, and I think that's what I'm addressing.
I think that's I'm sorry, this is Monica Shipper with Nevada Health Authority. I believe subcommittees were addressed in folks' bylaws, if I'm not mistaken. And that, so when you're talking about, I'm sorry, that's Azrael, correct?
Yes.
Yeah.
Yes.
Yes. Yeah. When you're talking about limitations, do you mean as far as being able to meet outside of the actual quarterly meetings, or what exactly like support you would need, or because I believe we do have it addressed in your bylaws for being able to, the chair, I believe, can form subcommittees, and we can support you folks in any way. If you want to have virtual meetings outside of the meetings, we would just still have to make sure they would be subject to open meeting law, just like this meeting is, and we just have to put the agendas together. And I'm gonna rely on the administrator and deputy director who are in the room with me to make sure I'm not talking out of turn. But we would just have to rely on making sure we posted those agendas and that they were open meeting law, but definitely able to have those types of subcommittee meetings. If you folks decided to do that, you would just have to establish them, put them on an agenda for next time and put those in. But we could definitely get that information out to the committee members for sure.
And to clarify, You're agreeing to subcommittees performed by the chair members and how they implement it, as long as MAC and BAC support crew are on board in making sure it happens, right?
I'm sorry, I'm having a hard time hearing you.
Oh, can you hear me? Sorry. Can you hear me? This is Azra. Can you hear me? Okay. So I just wanted to clarify, I apologize. So you're saying we can form subcommittees and it would be implemented by the chairperson of each, either MAC or BAC. And as long as you guys, the support team, are involved, then it would be okay.
Yeah, so I think that what I'm trying to say, I'm sorry, is that the chair can form these subcommittees, but you folks would have to, I believe that's an actionable item. So it would have to go on to your agenda next time to be able to vote. Once that happens, and if it's approved, then we can, the MAC support staff can support helping putting those meetings and agendas together. I believe there's also something in the bylaws, I'm looking at these guys over here because they pulled them up, that says at least one BAC member has to be on each subcommittee.
Wonderful.
Is that correct?
And I'm looking for that piece.
Thank you.
David, in the meantime, listen to add there.
Hi there. Yeah, I do. This is a question actually. Does this committee have access to an analyst? And the reason I'm asking is when we look at like a big category like Medicaid provider retention and recruitment, it would be having an analyst would enable us to make it kind of more manageable, physical health versus behavioral health, critical specialists in urban versus rural. I mean, because if we kind of tackle everything all at once, it could seem a little bit overwhelming. Whereas if we can get an analyst to tell us specifically where the gaps in care are, we could kind of dial in a little faster.
Yeah, if that's something that you all are looking for, or data specifically that you're looking for, we can work on gathering that for the next meeting as well. Yes.
Thank you.
Sarella?
Hi, I believe you will discuss Assembly Bill 36, and I believe it's relevant to David's question. I believe he's the one who asked about the provider's claim of 60 days and how to appeal it. I believe Assembly Bill 36 is relevant to his question and not the other one. If Director Jensen can talk more about that in the upcoming discussion, I'd appreciate that.
Yeah, we will, during the legislative update agenda, I think it's maybe item 10, or item 9, we'll speak to that. Our team will speak to Assembly Bill 36. I'm happy to answer any questions there, but a lot of good bills relevant to provider administrative burden and clarifying the process on all of these items. So look forward to this group's feedback there as we move to implement that. Thanks, Azarella.
And so in regards to the subcommittees, Jonathan and I can work on getting some information out to the members around subcommittees and any requirements and what we would need to do in preparation for the next quarter's meeting, if that's helpful for everyone. We can send that out following this meeting.
Okay.
Can we have that agendized for next meeting to review it?
Yes.
On subcommittees?
Yes. Absolutely. Any other questions or comments in the work plan? Okay. So I would like to motion for us to have a 2-week comment period for committee members to submit thoughtful recommendations via email. Let's say by November 24th. Is that
So we can take action on what's on the agenda. So on the agenda, we have voting on the work plan. And so are you motioning to not
vote?
To hold the vote?
Yeah, we'll hold the vote and wait for feedback.
Okay, so we'll ask if anyone would like to second whether they want to vote on the work plan? No?
I'm sorry, this is Monica. I don't think there's a motion to vote on the work plan. I think there's a motion to hold the vote and collect responses for 2 weeks. So you would need a second for that.
And that's okay to do that, even though that's not specifically on the agenda.
So you're just revising. So what you can do is you can, yes, just not take an action to vote, and you can just ask for people to provide feedback.
Okay. So we just don't need to do it.
Okay, thank you, Monica. I just want to make sure I'm following all the rules.
Thank you. Okay, now I think we're on agenda item 10.
Perfect. First of all, thank you for that robust discussion. I look forward to everyone's ideas on what should be on the work plan as we move forward. Agenda item 10 is the administrator's report. And so at this point, I'd like to introduce the Division of Nevada Medicaid Administrator, Ann Jensen. Ann, if you might give us a few sentences for those that don't know you very well, and then you can go ahead and start your administrator's report. Thank you.
Absolutely. Thank you, Dr. Maniwala, and thank you all again. It's good to see you. For those who haven't met me, I am the administrator here at Nevada Medicaid. I stepped into this role in July of this year. I joined our state Medicaid team last summer, leading our children's behavioral health transformation. So I have a special passion for that project, which I'll give a quick update on. I'm excited for later today, but thrilled to be here. I believe what really drives me and energizes me in this role is trying to make our program work even better for recipients across the state and for our providers. And so this is one of my favorite days of every quarter, is getting to spend time with you all and hear directly from you on how things are going and how we can improve. So I truly appreciate the time and I'm really grateful to be here. So with my administrator's report, as I shared in the last quarter as well, I like to start with giving you all kind of a high-level summary of what are the priorities here within the state Medicaid program, what are we focused on as a team, and then I'll spotlight one particular project where I'd like to get your feedback or provide some additional awareness. So that will be the structure that I'll bring to you every quarter. Today, I will be sharing with you our top 3 priorities in Medicaid right now through the remainder of this year. Hard to believe we're almost through the end of 2025, but it's a busy end to the year for us. We have 3 key priorities. Number 1 is implementing our new managed care contracts that will begin January 1st, 2026. Number 2 is procuring our specialty managed care plan, which is a new health plan for kids with complex behavioral health needs or kids involved in our foster care system. And then 3rd is implementation of new federal and state laws that impact our Medicaid program. So I'll give you a quick overview of each of those, but I'm excited. We actually have a lot of good agenda items that touch directly on each of these as well. So I won't go into too much depth, but I will pause for questions at the end in case there's any particular area we'd like to ask questions or provide specific feedback on. So firstly, on the statewide managed care implementation, as you all know, as we talked about in our last quarterly meeting, we currently have a managed care delivery system for Medicaid members in our Washoe and Clark County areas. Effective January 1st, 2026, we have a new contract period between the state and managed care organizations that bid and were selected for these products. There are 5 plans that will be offering Medicaid services beginning in 2026. And those services will be available across the whole state. So essentially, we're expanding managed care delivery systems from just Washoe and Clark counties to all counties across the state. What's really crucial about this, I'm thrilled for Maria on our team to give more detailed updates, but what this whole group needs to know from a member perspective, we're in the heart of open enrollment period. This is an extended period this year that lasts from early October to December 26th. That is for all members who are currently in a managed care program. So Washoe and Clark members have an opportunity to select a new plan for the upcoming year. For folks that are in our rural and frontier communities, they will be assigned a plan, either CareSource or Silver Summit, the two products that are available in those areas. They'll learn about who their plan is in December for that January 1st go live. All patients in managed care will have January, February, and March, a 90-day period, to make a new selection if they would prefer a different plan during that period. So those are really key updates from the member perspective. From the provider perspective, this is a very similar process for our providers in rural areas in terms of contracting with a health plan they do already. It's just now going to be a Medicaid plan in addition to a commercial plan or Medicare Advantage plan as well. So I know there are a lot of work and time and energy going into those final details related to contracting with the health plans, both in the rural and frontier counties and across the state. So those are the big changes on the provider front. We also deeply appreciate your work to help notify members of your community about this change. You are a trusted voice in our rural and frontier communities, and we're grateful for your help in amplifying the message that folks will have a new insurer through the Medicaid program come January. And if they have any questions on that process, of course, to reach out to our state team. What's another really important thing to note for our members and for our providers is there's a lot of detail related to care continuity built into the beginning of this contract period. And what that means is for the first 6 months of 2026, the services that folks are receiving before this change will be honored in our rural and frontier communities to ensure that transition is as smooth as possible for our members. So happy to speak to details. And again, there's more information coming in a future agenda item. So I will not steal all the thunder from Maria, but I'm deeply grateful for our full team's effort to pull off what is a really significant change for our delivery system here in Nevada, and something I'm really excited to bring continued access and improved quality of care to members, particularly in our rural and frontier communities. So I will pause there for statewide managed care implementation. Any initial questions or comments on that piece before I move to item number 2?
Chris Larkins, for the record. I am curious with all of the, there's obviously so many huge changes and a lot of effort being put into getting these managed care process right. And I am wondering about the fee-for-service population, that now the fee-for-service is really just the disability, frail and elderly, and the Katie Beckett complex children. So on that, I guess I'm wondering if the federal and state changes, how do they relate to that waiver population on all the different levels, from provider network, enrollment, the procedure streamlining, prior authorizations? So I'm not sure if this is exactly the right place to put that, but it is something that the more that I hear about the managed care, I want, and maybe that's a space for a subcommittee that is the waiver population.
Yeah, absolutely. I really appreciate you raising, and I think what's going to be important, and we can get really clear as we talk about this, is that managed care and fee-for-service are two delivery system models of the same program. And what that really means is there are two different ways that providers are being paid for the services and members access those services, but what we're all fundamentally held to delivering is going to be consistent no matter who's paying the bill, right? We're all held to adjudicate the same Medicaid program in our contract with the government. And so any change to the Medicaid program that's applicable in federal law would apply across delivery systems. It may